think hope and compassion and empathy are our guiding principles here. We want to instill hope in individuals that we work with, young people and their families. But we also want for our teams to feel that sense of hope for youth. When we work with some of the most challenging cases in the province, youth who face the most severe mental health challenges, that sense of hope is so key to what we do.
When a young person is coming in with so much complexity and such severity, it is really about recognizing those small successes and understanding that sometimes it is about taking 2 steps forward, 1 step back, but you're still moving ahead, and constantly recognize the incredible strength that they have, the resilience that they have, and the courage they have to continue to move forward.
When people come in the state that they do, you want to make them feel welcome and feel like their son or daughter is going to be safe, in good hands.
A lot of places will offer cookie cutter support. You come in, this is what we do, hope it helps. And really focusing on client-centered care is really just acknowledging that everybody comes in with different needs and you're meeting those needs where they're at.
Leela is a therapy assist dog, or a pet therapy dog, and she's specifically trained to work with children who face emotional challenges or who have special needs. There are many cases that I've been involved in where a young person will not actually speak to me. They will rather spend time with Leela, and with time they may open up, and she plays a large role in that.
I think it's important to pair data with clinical judgment based on our experiences, based on our interactions, based on the input we gather from clients and caregivers. But the more and more data we have to complement that clinical judgment will lead to better decisions. We're trying to develop a structure in every step of the way of the client journey to make it more of a science as opposed to an art.
We really specialize in more of the intensive services. And what I mean by that is really with young people who have more significant challenges with respect to mental health.
We provide secure treatment in one of the 3 facilities that provide that kind of treatment in Ontario for young people under the age of 18. We have a Step Up, Step Down program as well, which is more of our voluntary admission side for youth under the age of 18. And then we have a separate program also for voluntary admission for individuals age 18 to 24. So really that entire population below the age of 24 we're able to provide treatment for.
Intake is a point when folks they're reaching out, there's information you need to gather, there's questions you need to ask, but I think the thing that we really strive towards is starting from that sense of creating safety from the get-go, helping folks to be able to feel and know that they are going to be supported through those processes. We've got folks that are phenomenal listeners, phenomenal at being able to help with really communicating to the folks they're working with that we've got you. Oftentimes, what we might be doing is we're planting a seed. You might not see that seed growing, but you've done something and down the road it could have an impact.
These young people are really my heroes, right? They have the courage, they have the strength to keep going day in and day out to continue to get to the point where they are finding hope.